Hello, everyone. Good morning or good evening, good afternoon. I am delighted to welcome you to our webinar organized by the IPA website editorial board. As you already know, the IPA team wished to invite members to renew their links and exchanges through a series of webinars on the infantile, the IPA Congress theme, which for the first time, due to the pandemic, will be held online in July. For those of you who have not yet registered to the Congress, you can do so following the link you see on your screen, which you can also find at the IPA website. Our webinar today is the last in the series on infantile, as next month, all of us, we could attend the Congress, where all these exchanges, as well as many other important dimensions, will be further developed. In the meantime, as all webinars have been recorded, you can rewatch them on the website. Today's webinar is the second part of the April's broadcast on the infantile in the work of Klein, Winnicott, and Bion, presented by Jan Abram and Bob Hinselwood. During the first part on containing and holding, you were more than 3,000 registered, the platform was overwhelmed, we encountered serious sound problems, and the time was too short for this so complex subject our panelists were sharing with us. Due to the complexity and importance of the topic, the fact that there was so much more to say and ask, as we received almost 250 questions, and because Jan and Bob did not have enough time to answer and so to clarify their positions, we suggested that they continue their dialogue today. So following the success of the first part of this webinar on April, we are pleased to welcome Jan and Bob back to further develop the ideas they presented and to elaborate on the questions and issues that arose. They will do so during the first slot of the webinar. In the second slot, during the question and answer session, we will open again the discussion with you, the participants. You can send your questions throughout the webinar, and to do this, please post your questions in the question pane on the panel control on the right-hand side of your screen. You must click on the small white arrow, which is located just before the word questions. A chat window will open where you can write your question using your keyboard and send it. And our guest will attempt to answer as many questions as possible. The infantile is a complex but very crucial notion, whether it is if we take it into account in the formation of the psychic, or if we admit it as a psychic component in adults. This engages psychoanalyst identity and praxis. Today, we have the pleasure to listen to Jan and Bob developing and elaborating further their ideas, centering their contribution on infantile, containing, and holding. Jan and Bob worked together and published on Winnicott's Bion and Klein paradigms. In 2018, the clinical paradigm of Melanie Klein and Donald Winnicott, Comparisons and Dialogues, and it is in press for 2021, the clinical paradigm of Winnicott and Bion, Comparison and Dialogues. Before giving them the floor, allow me please to present them to you very briefly. Jan Abram is a training and supervising psychoanalyst of the British Psychoanalytical Society, visiting professor of the Psychoanalysis Unit, University College London, Vice President of the European Psychoanalytic Federation. Jan Abram has published several books and articles, and notably The Language of Winnicott, Donald Winnicott Today, The Clinical Paradigms of Melanie Klein and Donald Winnicott with co-author Robert Hinselwood, and forthcoming for 2021, The Surviving Object, Psychoanalytic Clinical Essays on Psychic Survival of the Object. Bob Hisenwood is a Fellow of the British Psychoanalytical Society and a Fellow of the Royal College of Psychiatrists, and is now Professor Emeritus of the University of Essex. He has written widely on Melanie Klein and beyond, as well as on the importance of the psychoanalytic unconscious in groups and organizations. He spent much of his career in the National Health Service with a special interest in therapeutic communities and was director of the Castle Hospital. Jan and Bob, please. Sound, please. Microphone. Thank you.
Hello. Thank you, Eliana. And well, good afternoon, everybody. It's afternoon where I am, evening, morning, wherever you are. Bob and I have had several discussions about how we want to go about this webinar. And we thought, rather than presenting a new presentation, we thought it would be more spontaneous to discuss and to address some of the questions that many of you did ask last time. And first of all, we want to say thank you to everyone for sending in all your questions. Thank you to Eliana for somehow categorizing the questions, putting them in different themes, theory, practice. It was very helpful. And so we're going to very much look forward to trying to address these points. I thought I'd say we also want to thank very much the IPA Webinar team, who are giving us a second opportunity to try and address some of these issues, because there is so much, as Eliana reported, to go into, and so many different misunderstandings, which as Heidi Feinberg has worked out and has identified, are very helpful, because it's through the misunderstandings that we can get to the underlying basic principles. And that was our aim when we first started these workshops on Melanie Klein and Donald Winnicott many years ago now at the University of Essex. So our aim for this webinar is mostly, we thought, thinking about the infantile, the concept of holding in Winnicott's work, and the concept of containing, container contained in Beyond's work, was the obvious way, the obvious entry to start to think about the meaning of the infantile in these two rather different paradigms. And that's what we hope to say more about in this afternoon's webinar. So I'll just say one word about how I think about holding in Winnicott's work. And the title of my last presentation was "There's No Such Thing as the Infantile." Now, I just want to say something about that. The reason I use that title was taking it from Winnicott's 1952 paper, where he says for the first time, there's no such thing as an infant. And what he meant by that is that if you see an infant, you also see a mother. You see someone caring for the infant. Someone, he said, glued to the pram, which is a very English expression of someone who doesn't take their eyes off the baby in the pram, so that the baby may be separate from the mother, but nevertheless the baby is being watched over. And this, I think, says so much about what is at the heart of the concept of holding. And it's what Winnicott came to describe as the good enough mother, and how this good enough mother, who is a real woman and a real person, but how her interpsychic communication with the infant is internalized by the infant, so that the infant is never alone. And this relates to Winnicott's concept of the capacity to be alone. Bob, I can see I'm speaking too much already, probably. But just to complete my take on Winnicott's concept of holding, the individual, therefore, is never an individual. The individual is absolutely inscribed with early infantile experiences of the mother, and a good enough holding experience is obviously a great start in life. If there's a deficiency in the holding environment, then there is what Winnicott described as early psychic trauma. So he has two very different babies in mind when he thinks about the good enough holding and the deficiency of the holding. Okay, I think I'll leave that at that. And Bob, you could say something about containment.
All right. Well, yes, I think we should, as much as possible, try to discuss these things. And of course, one of the things that we have discussed in the book is about the perspective on the infant. And as you say, if you're looking at a mother and a baby, you see two people, one of whom is glued to the pram. Mother is there as an integral part of a system of a baby with a mother. That's the objective, that's the perspective of the observer. I think what the Kleinian view tends to be is to try to take the perspective of the infant. And that is the perspective of the infant is that as I understand it, from a Winnicott point of view, the perspective of the infant is that there is no mother. And one could almost say that from the infant's point of view, there's no such thing as mother. Whereas the observer would say there's no such thing as a baby, at least a baby on their own. What I wanted to just introduce this session with was one or two more historical remarks on a well, sort of a historical narrative which I have in mind about the development of the Kleinian approach in general and containment in particular. This means going back a bit, and I hope it'll be interesting to say a little bit about the origins of a Kleinian approach, because I think they're very relevant to where we get to when we're talking about containment. But do interrupt, Jan, if you think I'm going off at a tangent or not being clear. But I did want to emphasize that Klein did not start really from where Freud started. In fact, it's not at all clear that whether Klein actually ever met Freud. Quite possibly she never did meet Freud. What she did was around 1920 begin to think about developing a play technique, which to some extent was based on Freud's dream analysis process. But her method was the play technique with children. This was not dream analysis. And I think we have to consider, well, my analogy is Galileo's started looking at the stars with a telescope, and by using a different method of observation, he made new discoveries. In particular, he discovered the moons of Jupiter. I think the Kleinian approach is very much formed from the basis of Klein's play technique with children. What she did was to give children toys, and she saw how they played with them, that the toys represented figures, people in the child's imagination. And I think this put her on a very different track from Freud, who was educated in the mid to late 19th century with a scientific background when physics was the physics of energy. And so Freud formulated the theory of psychoanalysis in terms of instinctual energy. Klein didn't. She formulated the idea of the mind in terms of children's play, the relationships with and between objects. She thought that the mind was composed of narratives between objects that the child played with. And I always rather emphasize a paper of Klein's which isn't much emphasized, her paper in 1922 on the personification of play, which describes this process where toys, little inanimate things, can be people for the child. And I think this is really, important and could have been a lot more developed within the Klein tradition and in psychoanalysis. But the personification is really significant in that, I think from Winnicott's point of view too, that something is seen as if it was something else, that the child puts into the toy something from the child's own mind. This was in 1929. Winnicott had been in analysis, I think, for about 5 years. Is that right, Jan? And I wonder how much this impressed Winnicott, which 20 years later resulted in his idea of the transitional object, which is the merging, somehow combining of something from me with something from not me. And I think Klein was sort of presenting this, perhaps not in such clear terms, when she wrote this paper in 1929. And I think this is an important aspect, perhaps, of the whole of psychoanalysis, but certainly it's a philosophical issue that is called German idealism, I think, which is background to both Freud and Klein. But what we see is not reality. What we see is reality as it appears to us, with our minds, with our conceptions, with our ideas, with our past experience. We see appearances. We don't see reality. And I think this is an important thing. I think this is fundamental, really, to the idea of containment as it eventually emerged in Bion's work. I think Bion was, he studied philosophy at Oxford, and I think particularly the work of Kant, who started German idealism, as far as I'm aware. And he was perhaps one of the most suitable people for developing the idea of this personification, that what we do is we contribute to what we see with our own preconceptions. I think what he was doing, what Bion was doing with the idea of containment, was considering the infant who has a very immature mind with no experience from the beginning, or virtually no experience. No experience to use to make sense of the reality that comes through the perception. So the infant needs a lot of help in developing its own meaning, the appearance of things that have meaning. And I think this is the background to what Bion was meaning by containment, that the baby, particularly the infant, needs something of an auxiliary ego to enable the baby to make sense, to make a meaningful sense of what comes through the eyes and the ears and so on of the baby's new experience as it is born. And this is, as I understand it, the way in which Bion focuses on containment, that the baby's experience, which is very difficult for the baby to make sense of, gets transferred into the containing object. At least that's the way it's experienced by the baby, so that that containing object can give it a sense of meaning, so that it has the conception, the baby acquires the conception from the object of how to see this thing that's in front of it, whether that's sight or hearing or touch or whatever. The perception is given a shape or a form through the interchange between the baby and its containing object, mother or carer or whoever it is, who can make sense of it. So the baby may feel hungry, for instance, and make a fuss with mother, cry out, and mother then has the capacity in her to say, I know what you're feeling, what you're experiencing. It's feeling hungry. I'll communicate back to you what hunger means by giving you a feed, so that something builds up in the infant to give a meaning to his own experiences, his own perceptions, I should say, so that the perceptions can become meaningful experiences. Bion, as we know later on, in 1962, wrote his book, Learning from Experience, where he formalized this as the process of what he called alpha function, which is a sensible meaning to the perceptions that we get. He talked about the matching of preconceptions which we have in our minds, which combine with what we see in reality, that he called realizations. These preconceptions and realizations are brought together in a process called alpha function, which then creates conceptions, as he called them. This is a theoretical, philosophical paradigm where I think he uses Kant and this idea of seeing appearances to try to formalize the processes that must go on in this very early mind of the infant who hasn't yet got proper preconceptions and experience to base his or her new perceptions on. So I'm saying that is sort of background, I think, to what I see as the containment, that it comes out of Bion's study of philosophy and Kant, and how he could make something of this movement in the infant, from infancy right through life, where we put our own something or other into the reality that we are perceiving in front of us at any particular moment. I just wanted to put that sort of background, which I sort of formulated in my mind since our last encounter. Have you got anything you want to say about that, or
Yes.
because it would be interesting to know how that compares with holding and the sort of background views that Winnicott used in the development of his idea of holding.
Yes. Is that okay, Eliana? I can't hear you.
You're muted.
There are some noises from, I think, some participants. They are not muted, but I would like to ask you to come closer to the infantile. I think I was saying that I think you are talking about the baby experience, but is the baby experience the infantile? Just a moment. Okay.
Can I just respond? Just
Yes.
very briefly to Bob. Because what you've done, Bob, I think is very helpful, because you've gone from Klein, who obviously was a great influence, not only in her theory, but in her practice with Bion, because he was in analysis with her, wasn't he?
Yes.
But what you've shown is that her focus in her work was very much the intrapsychic world of the infant. It's
Yes.
not that she ignored the environment, we know that, but really she was much more interested in what was happening in the infant's mind and how the infant was evolving, paranoid, schizoid position, depressive position. And then Bion comes along and he looks at the environment. And that was one of the points, wasn't it, at the last seminar, especially webinar, because that was associated with technique. We looked at it in relation to technique. So I just wanted to flag that as a response.
Well, let me just say, Jan, let me just add that it's not entirely polarized in quite that sort of way, because I have tried to convey that the paper on personification and Winnicott's, well, Klein's formulation is to do with the way the internal in the infant impacts on the reality that is there as the infant is experiencing it, as the infant is perceiving it. There is a difference, I think, in that there's a more of an emphasis in Klein on how the infant manages the impact of the external. The infant has a lot of work to do in managing that impact and making sense of it. I think it's not just a solipsistic, isolated set of fantasies. It's a continual process of trying to make sense of reality through the resources that the infant has got. Very few at first, but rapidly increasing as mother the carer enables the infant to have more and more resources to make sense through the process of containment. Sorry, I'm sort of taking over again.
Yes, well, I certainly didn't wish to polarize, because I think that would be really unhelpful. I don't know whether we're talking about emphasis. Maybe we are talking about an emphasis, but my understanding of Winnicott's concept of holding was very much, I think, a response to Kleinian development, in that and that's why I think he came up with the notion of the good enough mother, to emphasize, get away from the good internal object and the bad internal object. He wanted to emphasize the reality of the mother and her impact. And when you were talking just now, it did sound very Winnicottian, when you were talking about how the mother responds to the infant. I don't think we do get that in Kleinian theory. We get it a bit more in a theory of thinking, and maybe in post-Kleinian theory, there is much more of an emphasis on the psychic environment.
Well, yes, there was quite a strong movement in the early 1940s, wasn't there, with Bowlby as well as Winnicott, who criticized Klein for ignoring the actual external object, the external world. And I think that was felt by Klein and other Kleinians to be a considerable mistake. In fact, she wrote a paper challenging that criticism, a paper on weaning and the importance of the actual breast, which is there and then not there. She makes the point that the external object is of considerable importance. I think the emphasis that Klein makes is that the infant is much more active than a Winnicott infant, much more active in trying to make sense of what it is perceiving, what's coming through its perceptual apparatus, eyes, ears, the experiences from the body, especially at the beginning, the experiences from the body, the sensations from the body, I should say, and turning them into experiences. So I think for a very long time there has been this disagreement about what Klein really thought about the external object. And there's a lot of insistence. I know there's a lot of insistence from people who follow Winnicott, follow Bowlby, and so on, that Klein ignored the external object. And I think Kleinians have tried, really not very successfully, to challenge that criticism.
Well, I suppose it comes back to mythologies, doesn't it? As we also tried to address in the book, that it's very easy to say that's what happened and that's what they said and that's the way it is, instead of really unpicking and exploring. I just want to go back to what you said about Winnicott saying there's no such thing as a mother. I rather like that, actually, because I think that's true to some extent about the very early infant in Winnicott's work, which I think goes back to Freud and primary narcissism. And at the very beginning of our dialogue in our Klein-Winnicott book, that's what we started discussing. Do you remember?
Yeah, yeah.
And this is where we start to reach the conceptual basic assumptions that Winnicott's work, I think, was very much based on his understanding of the classical Freudian paradigm.
Primary narcissism, yes.
I think so. I think so, yeah. And I think that for him, therefore, when he talks about the infant being merged with the mother, so that when the baby sees the mother, he sees himself or herself, I think this is very much the primary narcissistic stage. And Andre Green and René Roussillon recently have shown how this is a development of Freud's primary narcissism. Whereas in Melanie Klein's work, there's quite a difference, isn't there? Because she disagreed with the whole concept of primary narcissism.
Yes, it's really quite an irony, really, that Klein, and she's absolutely categorical in, I think it's Envy and Gratitude, where she says that there is an ego from birth. There is an ego boundary. There is, from the beginning, a sense of self and other, right from the beginning. And the irony is, of course, that for Winnicott, there is no other. There is no external object for the baby. The baby has only a sense of self. And the irony is that Klein was saying, yes, there is an object right from the beginning. And the ego knows it has a boundary with the world around. So yeah. I think that's ironic and rather amusing, given that there's so much criticism that Klein thinks that Winnicott thinks Klein neglected the external object.
The thing is, though, I think what Winnicott, and I know that this came up a lot in our dialogue, that Winnicott does in his writings oscillate between the observer's point of view of the mother-infant relationship and the construction of the infant's developing, evolving mind and how it is evolving in relation to the mother's mind. And this is where I think he's very aware of the dynamic between the dyadic relationship. So I think it's very important to recognize that in the whole concept of narcissism, as I think Roussillon has pointed out, with Winnicott, we have more of a clinical concept, because his concern was, how does the baby go from what Laplanche and Pontalis have referred to as a monad shut in upon itself to the progressive discovery of the object? Well, the answer is through transitionality and through the transitional object. And I think that's what Winnicott answers for. So it's not that the baby doesn't exist, the mother doesn't exist for the baby, that's just to begin with. It's then the mother's task, through her primary maternal preoccupation, to facilitate the awareness of me and not me.
Yes, it is a fundamental different initial assumption, isn't it? There is primary narcissism according to Winnicott, where for the baby, it is only itself that exists, that creates the satisfying object, mother. Whereas for Klein, from birth, there is the experience of an object which is there, which somehow has to be made sense of and can be used to help make sense of the baby's sensations and predicaments as it finds itself in. There is an initial assumption. Either there is primary narcissism and no real appreciation of the object as separate from the self, or there is an assumption that the infant is aware of the boundary between the self and the other. These are incompatible incompatibly different initial assumptions.
How can we then think of psychosis? Because that was one of the other questions, wasn't it, in relation to the infantile. Of course, Freud says that the infantile, from 1909, the rat man, that the infantile is the unconscious. He says it categorically, and it is what has been repressed from the infantile experiences. The question is whether they're real experiences or intrapsychic experiences. That's the question that every analyst, I think, is concerned with in the consulting room. But does what we've just said about primary narcissism, would that make a difference to the way in which we think about the psychotic? For example, the psychotic patient on Beyond's couch in the presentation that you gave last time in April. Is that an example of the infantile in the session? Could we say?
Yes, and well, I think it isn't exactly. That's another. Well, that's another difference of view about what Klein was really talking about. And Kleinians do talk about psychotic anxiety. It's quite true, and sometimes psychotic defenses in the infantile. I think it's important to realize that there's a difference between the initial state of the infant, who has real trouble in understanding what the reality is, because he doesn't know how to use his eyes and ears and touch and sensations from his tummy and so on. Doesn't know how to make sense of those, which is different from the patient who is an adult patient, say, who is psychotic, who deliberately doesn't want to know what reality is and destroys the capacity in himself to perceive the reality, because reality seems too painful. So I think there is a difference of emphasis there between the infant, who is not yet endowed with the capacity to make sense of reality, and the adult person, or the more mature person, child, who has discovered reality but really can't cope with it, and therefore, as Freud described with Schreber, destroys reality, at least with his own mind. The world catastrophe, as Freud called it, is Schreber, and reconstructs a new reality out of his own mind. That was Freud's understanding of the dynamics of psychosis. I think with the infant, yes.
I'm very struck that you use the term deliberate, because you bring in the whole issue of intentionality of the psychotic. Would you say that's defensive, or the baby is born psychotic, deliberately destructive?
Well, I wasn't really talking about that destructiveness in the baby. I was saying the baby doesn't yet have the capacity fully to appreciate reality.
So the psychotic, so for example, the psychotic on Beyond's couch was deliberately destroying reality. But I'm asking about the deliberation of the psychotic. Yes. Is it defensive?
That's exactly, yes. It's a destruction of the capacity to be aware of reality. That was Freud's understanding of the Schreber case, and the reality is destroyed. In Schreber's terms, there was a world catastrophe. The world had disappeared for Schreber, and this was the destructive process that went on in Schreber's mind to get rid of reality, which he then replaced with something more congenial.
Yes, I think I understand that, but what I don't understand is how we can think about the roots of the psychotic, the roots of psychosis, whether it does come from the deficiency of the early psychic environment or not.
Well, I think I mean, psychosis in Freud's terms is the rejection of reality, the destruction of the capacity to recognize reality. Isn't that right? That's defensive. It's a use of aggression, self-destructive aggression, in order to protect oneself from the intolerable reality.
Which presumably originally was catastrophic. And
yes, it destroys the experience of a proper sense of oneself, which is why psychotic people have real problems with identity, who they are, and they invent identity. They identify themselves with celebrities and with divinities and so on. And that's different from the infant, who hasn't yet got a stable identity in himself. He recognizes, from a Klein point of view, recognizes there is a reality there, but hasn't yet solidified and stabilized what he is in himself.
Yes, I suppose I was wondering about this patient and how we would construct, which is totally hypothetical, of course, but how we would construct the difference between the infantile that he brings to the couch. I would think of it as possibly the infantile layer of his mind that is being played out, as it were, in the transference in relation to Bion at that particular moment, and the infant that he was, the real infant that he was, with the real mother. Because, of course, Winnicott's interpretation is that he had a very failing early environment. However good the woman was who gave birth to him, and however well she tried to give him what he needed, we've no idea. It's completely speculative. But would it produce this kind of very disorientated experience that this man was going through, which I think when you read it, it's very painful, isn't it? I find
Yes. So what are you asking about that? What is the infantile? Is that the infantile, you're saying?
No, even if we agree that it is the infantile, what relationship does it have with the real infant that that man was?
Yes. And as you say, we can't possibly know.
We can't possibly know, but we can. I think Winnicott does theorize that actually it relates to early psychic trauma.
Yes.
That is then getting reconstructed through the transference, because that's the other thing about the whole thing of primary narcissism and regression, which is another controversial point, isn't it? Is that man regressing to an experience that he really had, or is this all part of his early infantile fantasies? Is it the universal paranoid schizophrenic position, as it is with Klein?
Yes, I think it may be that Winnicott is very interested in reconstructing what actually happened then. I think Bion, I'm going back to that case that we discussed last time. I think Bjorn is interested in what is happening now and the capacity to recognize the reality in the room with the analyst right now, and it's what can be done with that experience right now between the patient and the analyst. If you remember the sequence, I'll just mention the sequence just to remind us that Bjorn's interpretation of this this difficulty in the patient to keep his mind together, properly functioning, Bjorn interpreted this and the difficulty with objects that the patient needs, that having interpreted that, the patient was then able to, for a moment, to recognize that he didn't know how he was going to manage the weekend. He had the capacity to recognize the reality that the session was going to come to an end and that the patient was going to have to survive the weekend. Now, this is a capacity that's bringing his mind together to be able to recognize time, separation, being on his own. This Bjorn would have said, did say, was evidence that something about the interpretation right now helps to reconstruct the mind right now so that it can, has the strength, has the capacity, for a moment at least in the session, to recognize the reality of separation. Now, I think it would, I think it's, there is this difference really, that does one really have to go back to the beginning of life to understand what was happening then? Or is it sufficient to understand what these infantile processes are which are going on now, and to help the patient to grasp reality in a different way, to be something of a container that can help the patient to contain his own experiences of the painfulness of the present. You mentioned the, were you going to say something, Jan?
There was, I just had a thought that, did Bjorn, do you think, does it sort of show us that Bjorn saw that the psychotic on his couch, because he does refer to the patient as psychotic, that the psychotic was caught up with the paranoid schizoid position, and that therefore his interpretations were aimed at helping the patient towards the depressive position? I'm saying it rather baldly.
Yes, yes. Yes, it's, we are talking rather broadly, aren't we? You see, I think, well, just to go back to a bit of theory in the depressive position, what Klein was trying to draw attention to was what she called the deeper layers of the unconscious, which is what I think I understand as the infantile in the present. These deeper layers, which are not so much concerned with neurotic conflicts, with the Oedipal conflicts, with the jealousies, the murderousness of the Oedipus complex, and so on. But what these levels of the unconscious are concerned with is the the capacity of the ego to be an ego. It has to be a coherent thing within the self, to feel that one is a self, to have an identity and to have the capacity to deal with what one is faced with in the real world. And it's that deeper level of managing the coherence of the ego, which is different from the managing the conflicts which the ego might contain.
I will have to interfere. I will have to interfere because from the one hand, there are participants who are asking questions, and from the other, that they are wishing more dialogue. So I will try to clarify a bit by a question sent by Nathan D. Could you both of you clarify the role that regression plays regarding holding and containing, and is especially addressed to Jan?
Okay, well, I'll try. Winnicott's theory of regression is really based on Freud's theory. I think he elaborates through his different language, but he's essentially looking at the layers of the mind and how they go back. The whole point of a fixation point and trauma is something that Winnicott writes about. The role of regression in analysis. Now, this is really, I suppose, what we were getting at just now, because if you think about the transference and the analytic situation, the analytic setting, everything that goes on, one could say, is in the now, it's in the present tense, but because of the transference, it's a paradox. It's the there and then, it's the here and now, but in relation to the dynamics of the transference, something very specific is occurring that is related to the infantile, as well as the child, as well as the adolescent, as well, if you've got somebody who's in analysis in their 60s, there are going to be other layers of their experiences that are going to come into the analysis at different times. I think what Winnicott was getting at was that there will always be the mother. The maternal transference is the most powerful transference of all. It doesn't mean to say that the lateral transference and the sibling relationships are not important. They're extremely important, but actually their importance as the paternal transference importance will come through the maternal transference. There's much more to say about that, but I think that's what Winnicott essentially was getting at. Now, in the high frequency especially, but even in once weekly analysis, I think there will be a regression to these early states of mind, especially where there's been trauma. And Winnicott writes about withdrawal and regression. And when he talks about the fact of dependency, what he's relating to is, can the patient, the underlying question is, can the patient really be in the analysis and relate to the analyst and become trusting of that experience? And so that, for example, lying on the couch doesn't necessarily have to be traumatic if the patient has had a good enough holding from the beginning. But there will be moments, inevitably, when it does become traumatic. I don't think de facto it is traumatic. And it's when those moments come up in the analysis, it will always be, in relation to the transference. Now, if the patient withdraws, because that's what they've had to do, withdraws from the analytic relationship and has to go into some kind of self-holding, there will be no opportunity to learn anything through the analytic relationship. It's only if there is enough of a trusting experience in which the patient can re-experience, revisit, language doesn't feel adequate to describe what happens in that experience. But if the patient can become, as it were, dependent and recognize their dependence on the analyst, and the analyst can receive that kind of experience from the patient and manage it, as it were, and find the right words, the intervention that will help in the way that Winnicott was trying to explain to Bion, then there will be a regression to dependency, and from there will be an experience that can heal, and an experience where the analyst is not behaving like the archaic object, as James Strachey put it, but the analyst shows the patient that this is a new way of responding to that old situation.
And Bob?
Yeah, well, there's so much to say, isn't there? And,
Not much to say, because now we are at the time of the question and answer, so there are a lot of questions, please.
Well, I'll try to be brief, but as you may know, one of Strachey's introductions, I think, in the standard edition, I think it's the introduction to interpretation of dreams, is that the different kinds. Freud used the word regression about different kinds of processes. One is temporal, just as you were talking about that, Jan, and the transference from the past. But Freud also talked about regression back through the psychic apparatus, what he called a topographical regression. And I think insofar as Kleinians do think about regression, it is much more of the topographical kind, the regression to these primitive and deeper layers of the unconscious. And just to try to put it in a clear sort of way, the transference for Kleinians is not really a transference from the past, although it has a lot of, may well have a lot of similarity with relations in the past. It's the transference from the present, from these deeper layers of the unconscious. There is not a theory of fixation points, because Kleinians tend to say that these deeper layers of the unconscious are constantly active. It's not that something stresses the person and then they regress to a fixation point, as Freud's temporal view of regression would say. Klein's view was of a constantly active, primitive level of the unconscious, which becomes more manifest in the relationship in the present, in the analysis. And this was a powerful point in the controversial discussions in 1943, 1944. I don't know if you will remember, many people may be familiar with Edward Glover's condemnation of what he called the Klein system. He refused to call it, as Klein, a psychoanalyst, and in fact he thought Klein should be thrown out of the psychoanalytic world because, he said, there is this idea of the constantly active primitive level of the unconscious. He said this rules out regression and fixation points, and therefore Kleinians are not psychoanalysts. He says this in his paper in the Psychoanalytic Study of the Child in 1945, where he described...
Yes, but Bob, the question was if you can clarify your position or be on a position about the regression.
Regression to a primitive level of the unconscious now, not to a regression to the past. That if we really want to help the patient, we need to help what's going on with them now and in the future. You can't change history. The point would be that we can't even know the infantile history exactly. What we can know are these primitive layers of the unconscious, which are concerned with the constitution and stability of the ego. That was what Bion was struggling with the patient that we discussed last time. So there's a regression from the deeper layers, there's a regression to the deeper layers rather than a regression to the past. And this is what Strachey was talking about in his standard edition, the difference between a temporal and topographical regression. Is that clear, Eliana?
Yes. There's another question. There is a vague but recurrent implication that Bion emphasizes on thinking and Winnicott emphasizes on affect. Beside the obvious artificiality of such a complete separation between the two, could you, however, especially Jan Abraham, comment on that, please? Do you want me to read it again?
No, I've got it here. Thank you, Eliana. Well, I'll just, I mean, I think a part of comparing and contrasting is one does easily get into these kind of differences, polarities even. I think Winnicott was always concerned with affects, but it doesn't mean to say that he wasn't interested in the capacity to think. I think there are, you know, one of the thoughts I had just earlier was that actually maybe what we should do more is sort of say, well, where do we come together? Because there are lots of points where we do agree and come together. And that's why Winnicott is often seen as a Kleinian. Although I think that we are showing today there are these very distinct differences where his roots are very firmly Freudian and not Kleinian: primary narcissism, regression, and affects maybe and thinking. So I don't really know how to answer that other than to say it makes sense that there's a focus on affects in Winnicott's work. But I think he was always very aware of the maternal role, but he felt that that needed to be addressed before the patient was able to think. I think going back to the psychotic patient, it does seem to me to imply that the paranoid schizoid position, which is universal in Klein, suggests that there is a psychotic infant from the beginning. And that, of course, is also very different from Winnicott. I noticed one of the other questions was about a psychotic mother. I don't think psychotic mothers may be very good with the baby at the very initial stages, but as Winnicott has pointed out, they couldn't help the baby, they couldn't facilitate the baby to evolve the me and not me, and that's where they got stuck with that sort of transition, couldn't offer the transition. So And a mother who neglects herself, well, a mother who neglects herself is not really a helpful mother for the infant. And that would be a sign perhaps of overinvestment, a narcissistic investment in the infant, which is not what Winnicott is talking about when he talks about good enough mothering.
Okay, to move on from psychotic points, another question. Given what Bob said about the psychotic process not being of the Oedipal, how do psychoanalysts use these concepts with neurotic patients? That is, there appears in an analysis a neurotic patient presenting with a particular hazard superego that seems highly related to the mind of 1 or 2 years old patient?
Yeah, I'm not quite sure I've got the question. I'm trying to look through
It's in your
these.
chat box. I have sent it in your chat box and the chat box of all participants.
Ah, yes, you have sent it, yes. Yeah, how do Kleinians interpret the Oedipal conflicts? Well, I think like anybody else, they are interested in Kleinian conflicts and how the person resolves those. What is particularly important is why would this person's ego have particular problems in resolving neurotic and Oedipal problems? Is there something particularly deficient in the ego of this particular patient? And of course, as you know, the concern that Kleinians have is the anxiety in the patient's ego about the imbalance between the love and the hate in the Oedipus complex, or in any situation. The anxiety is that hate outbalances the capacity to love and repair and restore. That is I think that's a particular issue that Kleinians would address. How does this person manage those two currents of feeling in the Oedipus complex? I don't know if that answers the question, but this
it is your answer. It is your answer anyway.
Mm-hmm. Yes.
I can go on. Would you both then say that the infantile means being in a state where one cannot make sense of their perception on their own? I think it's about integration of internal and
Yes. I suppose just to start that briefly, that would be accurate. Yes, that the infantile is the difficulty in using the resources of the ego to make sense of reality, of the actual reality that's there, to give it an appearance of some meaningful experience. What about Winnicott?
Well, I'm not sure how to answer that. If I think about, if I think about regression, I think, as Winnicott has pointed out, there's a regression to the good times as well as the difficult times. And I think that there are patients who can go back in time and regress on the couch and feel free to be playful. It doesn't all have to be about trauma and difficulties. and psychopathology. There's also the whole point of the infantile in the adult. There's always an adult who is bringing the infant to the analytic situation and taking care of the infant or not taking care. I mean, and all of that is something that becomes part and parcel of the transferential analytic work.
And it is a question mainly to Bob, but I think it is very interesting for both of you. What implications for technique do you see coming from the differences in the concept of regression?
Well, there's no such thing as regression in Klein. That's so that would be a difficult question to answer, I suppose.
Well, I've made the point it's a different kind of regression. Yes, it's not talked about as regression so much. But yes, it is to speak in some way. I mean, we both have a problem, I think, when we are interested in the pre-verbal infant. How do we talk in language to the pre-verbal infants, the infant at that very primary level that we're both interested in, whether we see it as the past or whether we see it as the very deeper layers of the unconscious. I think that a Kleinian view, maybe I would be need to be in discussion with my colleagues a bit, but I think there is, since Beyond's paper on the differentiation of the psychotic from the non-psychotic part of the patient, which Jan, you were sort of referring to when you say there's an adult part of the patient. There is an adult part of the patient that comes, a non-psychotic part of the patient which comes and to whom one can talk. The non-psychotic part of the patient is the one that's capable of thought, of representation, of language, and that's who one speaks to in the patient. You cannot speak to a pre-verbal infant in the patient. I think a psychoanalytic view would be that the differentiation of psychotic from non-psychotic parts of the person is extremely important, and to capture the balance between these two parts of the person, that if one speaks to the adults, to the non-psychotic part of the person, the personality that can use words, one is in some sense strengthening that part of the person against the, well, what can I call it? Not regression. I mustn't use the word regression. The more psychotic part of the person that comes from the deeper layers. If there is a balance between something which is aggressive, destructive, and self-destructive on the one hand, and another part of the person which is much more reparative and capable of constructive and generative thinking and speaking, then if you speak to that more generative part of the person, one is influencing the balance between these two parts of the person.
Yes,
and
that makes sense. That makes sense, Bob. I've just had a new thought, which is not probably lots of people have thought of this before. I'm not saying it's so original, but it occurs to me now that the psychotic part of the personality is the infantile, inasmuch as it's the paranoid schizoid position, and the non-psychotic is the depressive. Look, I'm really polarizing here and making it perhaps oversimplified, but it suddenly occurs to me that I'm not sure I agree that there's always a psychotic part of the personality, actually, if I come from a Winnicott paradigm. But maybe from a Kleinian paradigm, there's always a psychotic part of the personality if you believe that the paranoid schizoid position is universal, and what the infant feels at the beginning, or what the state the infant is in at the beginning. I'm just wondering.
Yes, I think that's right, that Klein would say there's always the potential to move towards, regress, in a Kleinian sense, to something paranoid schizoid, to a paranoid schizoid position. You know, if you're driving down the street and somebody overtakes you dangerously, you're liable to swear at them, even though they don't hear it. You are angry and hostile towards somebody who's.
But that's normal. That's normal.
Yes, yes, that's normal.
I will ask.
Yes, they are bad. They are evil.
I will go on with the next question. It is related, that is why. The example of the psychotic patient that Bion was trying to help to reconstruct his ego function is really too different to the way that Winnicott speaks of the need from the environmental mother to construct the baby's ego?
There's a lot that's similar in that, but there is an essential difference. One is that the baby has the capacity to recognize reality as separate, whereas for Winnicott, if I'm right, Jan, for Winnicott, there is the necessity of a carer, a good enough carer to bring out that.
No, not a carer, a mother. It's the mother.
No. Yeah. Well, all right, whatever you call it, but there's a necessity for a mother to bring the reality to the
facilitates or does like the animals. Can I just say one thing? I wish we had clinical work. We did have the clinical example of from Bion, which we started with last, but I was thinking I did have a clinical example. It's too late now, but I wish we'd had more clinical work, because this is where I'm sure you feel the same, Bob, because in our other workshops we've commented on clinical work, fresh clinical work, and that's helped to facilitate our definitions. Otherwise it can get rather polarized and theoretical rather than actually looking at what is the transference and what is going on between the analyst and the patient, and how can we reflect on this in relation to the infantile.
Thank you, Jan. I would like to ask another question. Is the experience of being contained in analysis important also for the pre-verbal infantile part of the person? That will possibly be a way to communicate at a pre-verbal level.
Have you got that written on the chat?
Comes. Here it is.
Thank you.
The pre-verbal level, in my view, is always going on in all relationships. It's going on right now, I would suggest. So I'm not quite, I mean, I'd need to hear an elaboration of that, but Yes, silence is you know, if we were going back to technique, thinking about technique, silence and holding. In our book, you know, a chapter was holding and the mutative interpretation. You can't get to a mutative interpretation or a mutative process without the holding of the analytic situation, which requires silence and listening and being before doing, is what Winnicott suggested.
Yes, there is non-verbal communication, isn't there, all the time in all relationships, including the psychoanalytic relationship. However much one tries to practice the blank screen, there is always a person who is connecting at a non-verbal level with non-verbal communications. But the particular technique of psychoanalysis is to move from those non-verbal communications to verbalize them, to put them into the shape of a verbal communication. I think that's the important thing, really, not that it's one or the other.
Sorry, I would say with Winnicott, the non-verbal is as important as the verbal.
And
well,
now,
it may be, yes.
There is 1 minute left. I would like to thank you both for your wonderful presentations. You both presented how the ability to develop a productive mental apparatus for analysts also depends on the interaction, but also on the integration of the earliest experience of life. We have many resemblances, but differences also, and you pointed very, very clearly. It is the last minute. We would like to thank you very much. Thanks also the participants. There is a lot of questions to answer, but I think it will be done by emails this time. For all participants, they can follow the developments, the further developments during the Congress on July. And I would like also to announce in the next webinar, it is not an infantile series webinar, it is on the work of the IPA Intercommittee on Prejudice and Racism. It is for the 25th of June. And we are going to say goodbye and see all of you at the Congress. It will be online. Save your place, and we are going to continue thinking and discussing together. Bye-bye.
Thank you, Eliana, and thank you to all the participants and the questioners. Thank you, and good night.
Bye.
Bye. Bye. Bye.